Hello, everyone. On behalf of the American Heart Association and the Joint Commission, I would like to welcome you to our webinar, Patient Care First, the Path to an Efficient Heart Attack System of Care. My name is Jana Petschak, and I am the Senior Program Development Manager for Get With the Guidelines Coronary Artery Disease. I will be your host for today's event. Today, we'll explore how the American Heart Association and the Joint Commission's cardiac certification programs can empower hospitals nationwide to enhance the quality of care and patient outcomes. We'll also guide you in determining which certification aligns most closely with your hospital's goals and discuss what can be expected during the review process. It is my pleasure to present today's speakers, whose experience and insights will guide us through this important discussion. Alicia Webster is a Senior Healthcare Quality Solutions Manager at the American Heart Association with over 21 years of experience in healthcare and quality improvement. She previously worked in hospital quality, cardiac cath and electrophysiology labs, and radiology imaging. Alicia is dedicated to enhancing patient care by partnering with hospitals on certification and quality initiatives, helping them implement evidence-based guidelines that drive better outcomes. She is a graduate of the University of Oklahoma and is a certified professional by the American Heart Association in digital health and cardiac care. Zachary George is the Director and Subject Matter Expert for Disease-Specific Care Certification at the Joint Commission. He helped develop and launch the Heart Attack and Comprehensive Cardiac Center certifications alongside the Heart Association. Zach works nationally with healthcare leaders to build efficient cardiac systems of care and supports organizations throughout the certification process. He holds an MBA in Finance and Marketing from Indiana University's Kelley School of Business and is a certified public accountant. Andrea Yates is a field director for disease-specific care and healthcare staffing at the Joint Commission. With deep experience in heart and vascular clinical care, program development, and implementation science. She holds an MBA from Miami University and a BSN from Wheeling University. Andrea is an active member of several national cardiovascular and quality organizations and enjoys living in the mountains of Western North Carolina. With that, I am pleased to turn things over to Zachary.
Thank you very much, Jana. Can you hear me okay?
I sure can.
Okay, well, thank you for the introduction, Jana. And you mentioned that I went to Indiana University, so I don't know if anybody else knew this, but when I was there, we were the worst football team in the world, and now we are the national champions. A round of applause. A lot of people are champions, but when you've never even been good and suddenly are the champion, we got to call that out. So anyways, thank you very much. And thank you everybody for joining this important webinar today on heart attack systems of care. We've been working together, the Joint Commission and the American Heart Association, for quite some time to really fine tune and create a meaningful and a useful certification program in conjunction with the Get With the Guidelines registry. So Felicia, if you'd like to go to the next slide. So a couple things I'll just cover that my teammate Andrea and I will cover today. Again, just a quick introduction to the heart attack system of care, the concept and the structure. We'll talk a little bit about how Joint Commission certification supports ongoing performance improvement efforts and summarize the disease-specific care standards and metrics for the different levels of heart attack certification. Finally, we're going to identify some resources that are available to help you prepare for certification as well as the application process. And finally, the most insightful piece will be with Andrea to actually talk about how that review or the on-site review takes place and what the characteristics are that make that so useful and meaningful to you. All right, so the heart attack system of care, if you go to the next slide, Alicia. First of all, again, we've been working for over 20 years in collaboration with the American Heart Association. Obviously, we truly value the expertise and all the years of expertise that this association has played in the development and the improvement of care that is provided to stroke and cardiac patients in this country. It's amazing partnership, and we feel very fortunate because our paths have crossed and they are now walking hand in hand. And over these 20 years, we now have nearly 1,500 hospitals that are certified through American Heart Association and Joint Commission programs. That's 1,500 hospitals. And I want to point out that some of these hospitals have multiple sites, and many of these hospitals have multiple certifications. So 1,500 hospitals have employed at least one or multiple of the stroke and cardiac certifications that we've developed over time. We can go to the next slide. But the why, we talk about this at the beginning of every conversation about heart attack systems of care. The numbers have plateaued with about a little over 800,000 heart attacks happening each year in America. The first heart attack, that's about 605,000 folks, but another 200,000 have another heart attack. And again, in less than every minute, there's an American having a heart attack. And if we relate this back to cardiovascular disease, every 34 seconds, someone dies from cardiovascular disease. So the plateau itself, um, you know, it, the, the growth in the quantity of events has not increased, which is a little misleading. The plateau itself, it hides some worsening underlying risk factors. So, for example, we know there are increases in the rates of obesity, especially if you roll into that overweight and obese. 72% of Americans of adults are impacted by obesity or being overweight. Pre-diabetes and diabetes, that affects more than 57% of adults in this country. And then hypertension has increased to 47% of adults. That alone is a sign when the underlying risk factors are increasing. The quantities can be deceptive. Population rates change, disparities of care throughout the country change. And what we know are the underlying risk factors are increasing. So the importance of our work together couldn't, it's definitely just as critical as it was long ago when we developed these stroke and cardiac programs. Another thing I wanted to point out, Alicia, if you'll go back to that slide, another reason this is such an important moment is that recurrent events remain high. So we're doing a great job the first time when we receive them in the emergency room, when we send them home. However, they're returning. They're returning. So there is the follow-up care. There is the patient's willingness to follow the guidance that the healthcare system is providing them to prevent a recurrent event. That is something that also remains high. So very important. And finally, when you look at the populations, we have an aging population, and you hear that often. But another thing that really stands out is the recent research that shows increases in these risk factors and these events for our younger populations. So now we go to the next slide. This is just as critical a time as ever in taking a look at the quality of the hospital chest pain programs is fantastic. What we need now is to develop a system of care that unifies those organizations into the most effective structure with the goal of getting the patient to the right care at the right time, at the right location. And this is exactly what we have built in the stroke world. And now we have this taking place in the heart attack space. The right care at the right time. And at the right time means as soon as possible. So we'll talk more about that in a minute. As far as the certifications themselves go, one of the biggest things we accomplished with this certification program is that it is aligned with the other Joint Commission certifications that your hospitals currently hold. And what does that mean? It's the same standards manual, the same standard structure, the same on-site review agenda, and all in all, it makes it much easier to plug this uh, this amazing cardiac certification right into your quality department. Also, the alignment again with the guidelines, with the Get With the Guidelines registry, and that has always created the most efficient blend between standards and performance measurement and improvement. It's also aligned with a system of care model that we know works: acute, primary, and comprehensive. It has worked since the 80s. We've developed that for stroke, and it is just as effective in this heart attack space. Finally, the last two are, it's aligned with the clinical practice guidelines. In other words, those are incorporated right into the standards in many cases. And then the other piece is that there are not two organizations that are more available to you to support and help you achieve your goals than the Joint Commission and the American Hospital Association. We have the resources, we have the people that are available to get on the phone with you at any time. So just want to point out that's one of the missions we wanted to accomplish to help you pursue certification. If you go to the next slide. So the scope of these certifications, it includes a review of all ACS conditions and complications. So your unstable angina, and STEMI. At the same time, the cardiac arrest, the resuscitation, the cardiogenic shock. Different levels of heart attack center have different capabilities as well as response. I guess you could say roles that they play in their community with these patient types. But the important thing is this certification is, in the truest sense, it is reviewing your chest pain program. The receipt of a chest pain patient in the emergency room, and then the assessment, and then the diagnosis, and then the timely steps that are taken and the pathways that are followed for the ACS related chest pain patients. Again, we delineated that into levels: the acute, the primary, and the comprehensive. If you want to go to the next slide. So this is the heart attack system of care, the acute, primary, and comprehensive model. And the Acute Heart Attack Ready is the referring center. This is the organization that is able to receive anyone with chest pain, signs and symptoms, perform that immediate assessment, and determine the correct path. In the event it is a thrombolytic, they have that capability. 24/7, that emergency room is open, able to do that assessment and able to take that initial treatment. In the event that the signs indicate that intervention is necessary, then the Acute Heart Attack Ready does not need to perform those interventions. Okay. The primary heart attack center is the next level on the system of care. The primary heart attack center has the 24/7 capability to, if it's deemed necessary, perform the primary PCI on the emergent STEMI patient. So an acute heart attack ready, it might be able to do PCIs, but maybe it's not 24/7, or they completely might have no PCI capabilities. Either way, in the event a PCI comes about, they're not able to serve it, they send that to the primary heart attack center or the comprehensive center. But the primary center, again, its main characteristic is at any time of day, any day of the week, they have the ability to receive a STEMI patient, perform that primary PCI procedure. The Comprehensive Heart Attack Center has that ability, but at the same time has the ability 24/7 to provide the surgical solutions that might be necessary for a STEMI patient as well. And the Comprehensive Cardiac Center is not really a topic we're going to cover today, but I did want to include that in this system of care just because that is an additional certification, but that is the mothership of cardiac care in a community. This is the full scale cardiac program that involves not just the STEMI and NSTEMI and chest pain patients, but also things like valve repair, EP services, heart failure, cardiac rehab, really all domains of cardiac care. The Comprehensive Cardiac Center, in effect, is a comprehensive heart attack center, but also has every other domain. So we won't get into details about that program today, but I just wanted to point that out. And one other thing I just wanted to say is that the idea of the system of care and the way this can help in this critical time is this system of care helps in conjunction with certification and the Get the Guidelines registry. And it helps by standardizing and elevating care. It standardizes reliable processes for rapid diagnosis and treatment of these patients. It also ensures 24/7 readiness, and that is communicated, and that is, top of mind for our EMS organizations and hopefully our patients. 24/7 capabilities at different locations. Another thing, it reduces variation in the care in different communities. It decreases the variation in care over time. And this improves equity. This improves everyone has the same shot with regards to the EMS and the routing and the timeliness to the diagnosis and treatment. And that's another goal that in a fragmented, non-formalized system of care, you might struggle with. That's one of the benefits of this system care as well. And then I'll just, that is the primary thing this assists with. It strengthens regional systems of care as they are being managed and developed by local EMS organizations or states or health systems. Next slide. And if we go to the next slide, we'll take a look real quick at a summary of the different programs. So Acute Heart Attack Ready. So again, Acute Heart Attack Ready organization does have the 24/7 capability to receive patients showing the signs and symptoms of chest pain, and then to be able to diagnose whether that is ACS or not, and then has the ability to provide care, treatment, and services for adults with ACS and related complications, such as arrest and cardiogenic shock, on-site 24 hours a day, 7 days a week. Now, the unique thing about AHAR, they are not required to provide the PCI for the STEMI patients on-site 24 hours, 7 day a week. Acute Heart Attack Ready does not have to hit that 24/7 threshold. It doesn't need to provide PCI at all if it doesn't want to. If it's doing PCIs part-time for the STEMI patients, but not 24/7, that is also an Acute Heart Attack Ready. An eligibility requirement, the only volume requirement is that you have been open long enough that you've served 10 ACS related chest pain patients. So in other words, if you're a brand new freestanding ED, we just need to see that you've done 10 and then we can come in and do the certification. Another requirement for all the certifications is that you are participating in that great Get With the Guidelines CAD registry and using that to understand your performance and proactively drive improvement. Next slide. So a few of the key measures for Acute Heart Attack Ready, just so you can picture this. If you will go to the next slide. There we go. There's 4 standardized measures for acute heart attack ready. All of these are calculated for you by the Get With the Guidelines CAD registry. But just so you can picture the types of things and processes that we'll discuss when we're there, we're looking at ECG within 10 minutes of arrival. That's one measure. Arrival to thrombolytics within 30 minutes, and arrival to transfer to a PCI center within 45 minutes, the door in, door out. In the event you're performing a PCI. So again, you might, in an AHAR, you don't need to do 24/7 PCI, but you may have some PCI capabilities. So in the event you do some PCIs, then there's an additional measure, which is the EMS first medical contact PCI. So again, if you take a look at these measures, we're really looking at the timeliness of care in that initial stage of chest pain diagnosis. One thing I'll point out about all these measures is that for the sake of maintaining certification, we have not identified a threshold that you need to hit on any of these measures. So just so you know, there is no eligibility requirement that says your average ECG time needs to be this to qualify for certification. We have not established any of those thresholds, primarily because of the variation you can see in different communities, all of which could benefit from certification. All right, let's take a look at Primary Heart Attack Center. So again, the primary eligibility requirements are the same. The one thing that's different, you provide primary PCI for STEMI patients 24 hours a day, 7 days a week. So you have the ability to have on site the team and the resources necessary to perform that STEMI. And that's in a time frame that meets the needs of the patient. So you have the ability 24/7 to get the people and get everything set up on site to perform that procedure in a time frame that meets the needs of the patient. Next slide. So the main measures that we look at here are the time to the primary PCI being performed, as well as the time from first medical contact, first EMS contact to PCI, as well as arrival at the first facility to primary PCI. So we're just looking at times there, the times in between initial diagnosis and getting that PCI performed. Again, all these results calculated for you by the registry. For Comprehensive Heart Attack Center, the same eligibility requirements. Again, you do have the 24/7 capability to perform primary PCI for STEMI. In addition to that, cardiac surgical services are available on site 24 hours a day, 7 days a week. At the same time, the Comprehensive Heart Attack Center obviously will be receiving and managing the more complex and critically ill patients. So we'll also want to learn then about the advanced hemodynamic and mechanical circulatory support programs that are available there, the cardiac critical care, their approach to cardiogenic shock, resuscitation, and as well as rehab for that matter. So again, this is the Comprehensive Heart Attack Patient Center, where everything that might take place from diagnosis through discharge, through rehab, are incorporated into the review of a Comprehensive Heart Attack Center. Next slide. And you'll see we had some additional measures then due to the comprehensive nature and the complex nature of these patients and the procedures. So the ACE inhibitor and ARB, the ARB for the LVSD patients in discharge, a rehab patient referral from an inpatient setting, your ACE inhibitor or ARB prescribed at discharge. Once again, very popular. And then even the dual antiplatelet therapy prescribed at discharge. So we just go in a bit more detail about that discharge and about the medication on which these complex patients are discharged. Next slide. So now I just want to talk a little bit about the the concepts that are involved in certification and how they play out in the standards as well as in your certification experience. The primary elements of certification are, first of all, the evidence-based, the science that has been accumulated over the years, and the evidence-based recommendations for care that have been pulled together and published for you in the form of clinical practice guidelines. And that is the co-host of this event today is that organization that works with other organizations to create those guidelines. That's essential part of the certification programs just to verify those are being implemented. Performance measurements, another key element of certification, having a formalized process by which you do track your progress on key metrics and really understand the trends, what are affecting our results up or down over time. And then proactively having a performance improvement plan that you yourselves manage. You don't want to you don't want to wait for a survey organization to come visit you and then tell you, hey, your time to PCI is not high enough. We'd like you to improve it by this much. Could we see an improvement plan? That's not the goal of disease-specific certification. The goal is you measure your performance and you proactively identify a tailored performance improvement plan that is the most appropriate for your organization. The other elements are the disease-specific care standards that we have written and developed over the last 40 plus years. And then that takes the form of our web-based manual called eDition, which we'll talk more about in a bit. Next slide. All right, next slide. So certification supports continuous performance improvement, and the primary ways this works, and it demonstrates an organization's commitment to continuous improvement. You have a PI plan, you identify goals, and you track your achievement of those goals over time. If people say, what data exists to show this is beneficial? The data is inside every individual hospital's certification, and it's documented there by the identification of improvement goals, the majority of which are achieved and that are observed during our on-site reviews. Improvement is the essence of certification, and it does work. So the program requirements and standards are something that are written to be interpretive. And the reason we do that is then they can be accomplished by each infinitely unique heart attack center. It also drives a consistent method of delivering clinical care that's based on the guidelines, performance measurements incorporated, proactive improvement. And then every 2 years, we do a review of your program with you, where we send a peer of yours to visit, to spend time with you, to see how your program is operating at that time. You'll hear much more about this from Andrea later, but the goal of that review is to really stay connected, really understand what you're working on, hearing what your challenges are, sharing what we can, and really making sure it's a meaningful and beneficial time that we are together every 2 years. And in between years, we have an intracycle call. And the point again is to stay current and see how you're progressing on your PI plans. Okay, let's go to the next slide. And next slide. So just a real quick overview. We have 6 chapters of standards, and I don't know if we have any individuals that are familiar with hospital accreditation, but that's 16 chapters of standards, and several of those chapters for accreditation. They have engineers involved. That's scary, looking at fire systems and HVAC and the building doesn't look safe. So the nice thing about certification is one of the requirements is that you're already accredited as a hospital. In other words, those 16